Minnesota was back in the spotlight this week in congressional Medicaid fraud hearings, and the legislature is already moving ahead on some key health matters. Welcome to the March 6th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mochtig.
Minnesota's governor and attorney general were in Washington this week for a grilling by the Republican-controlled House Oversight Committee. Members of Congress pressed Tim Walz and Keith Ellison on how long fraud in child care and feeding, autism treatment, non-medical transportation, and other programs had been going on, and why the state didn't step in sooner to put a stop to it. Ohio Congressman Jim Jordan joined fellow Republicans in suggesting that Medicaid fraud in Minnesota had a political purpose.
There was a perception that forcefully tackling this issue might cause political backlash among the Somali community, which is a core voting bloc. Did that have anything to do with this whole fraud scheme that went on in your state, Governor?
It did not, Congressman.
Did not.
The hearing came amid what has now become a legal battle. Minnesota has sued the federal government for more than $240 million in unpaid Medicaid reimbursements. The Trump administration froze funds as part of last week's launch of a so-called war on fraud. That money is only about 7% of the state's expected Medicaid funding for the first part of 2026. The funds pay mostly for social service program reimbursements that have been the focus of fraud investigations. CMS Director Dr. Mehmet Oz said this week he's confident the freeze will survive Minnesota's court challenge. He also said that federal investigators would be turning their attention to nearly $130 billion in Medicaid spending in New York. Oz posted a video on social media saying adult daycare and personal care services in New York State were ripe for abuse.
New York already has high Medicaid enrollment, and in last year, 5 million beneficiaries, that's nearly 3 out of 4 Medicaid enrollees, received these personal care services. That level of utilization is unheard of and has made personal care services the #1 occupation in New York State.
As in Minnesota, Oz gave New York's governor just days to offer an explanation and roll back any fraud in the programs. Oz said investigators are looking into programs in Maine, California, and Florida as well. This week, CMS also announced a 6-month moratorium on new Medicaid enrollments for durable medical equipment companies.
Back in Minnesota, after the state budget forecast rolled out last week, it's report season at the Capitol as government agencies were issuing findings on a variety of issues. They included the second year of a state look at the federal 340B drug discount program. A report from the Minnesota Department of Health totaled revenue for hospitals, clinics, and other so-called covered entities at $1.3 billion, savings from discounts on prescription drugs that are billed to patients and insurers. It's more than double last year's figure, but this year includes so-called administered drugs, including pricey chemotherapy and other prescription medications. Drug makers told legislators in St. Paul that the program had little benefit for patients and would crimp future drug development. Carrie Mikulski, CEO at Riverview Health in Crookston, told a Senate panel that Riverview's $2.2 million in 340B proceeds pay for supplemental mental health programs for seniors and covers more than a $1 million annual deficit from birth-related services.
Medicaid is the predominant payer for our births in our community, and every Medicaid delivery is underfunded. Without 340B, this service would not be financially sustainable for Riverview Health in our community.
The Senate Commerce Committee approved a measure to guarantee pharmacies could participate in the 340B program.
Another report this week looked at nurses in Minnesota and offered insight into the profession's struggles since the pandemic. A Minnesota Department of Health report found many nurses had retired or left their jobs since 2019. The study looked at a relatively small sample of nurses, but found that their career satisfaction had picked up in 2024, the final year of the study. It also found that 4 in 5 nurses were satisfied with their careers. Other action at the Capitol included consideration of a new agreement between the University of Minnesota, U of M Physicians, and Fairview Health Services. It would replace the expiring mHealth Fairview agreement and bolster the future of the state's graduate medical education.
Another measure going through committee this week would add security guards to the criminal penalties for assaulting healthcare staffers. It comes in the wake of a security officer's death at the hands of a patient in Wyoming, Minnesota in December. And a Senate committee approved another measure this week that would require health insurers to cover fertility treatments and cap cost sharing to match maternity coverage. And finally, there's a new study out by the RAND Corporation offering an unprecedented look at the impact of changes to Medicaid enacted by Congress last year. They're due to mostly go into effect next year. RAND projects the changes will cut medical assistance in Minnesota by a total of $2.4 billion by 2030 and will cost the state nearly $900 million over the next 8 years. It's the most detailed look so far at the state-by-state impact of the many changes included in the One Big Beautiful Bill Act passed by Congress in July. You can read the full RAND report at hospitals.mn/RAND report. That's hospitals.mn/RAND report.
That's it for this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Abby Mocktig.
And I'm Tim Nelson.
Thanks for listening.